Hello, my name is Christine Diaz, and today I'm going to be presenting for undergraduates who are coming into the mental health professional field. And this presentation will be focusing on the ethical standards that anyone coming into this field should be following. I will be covering concrete examples of conflicts of interest that can occur, as well as how they can be seen within the Christian ministry, how our own values can conflict with decision makings and the impact that it can have on clients and how to resolve them. I will also be touching on ethical principles within mental health and wellness and ethical dilemmas that can arise with working with clients and how to navigate through those dilemmas as well. First, I will be focusing on two conflicts of interest. The first one will be financial agreements. This is where mental health professionals may promote clients to other service providers, including certain treatment facilities, experts, or even pharmaceutical businesses in exchange for a commission or bonus. According to the APA, or American Psychology Association, nearly half of the United States has regulations on this sort of benefits for referrals, but there are ways to go around this and still partake in this type of practice. Unfortunately, this prohibition doesn't affect employment arrangements, and healthcare providers can still receive a type of compensation as employees, independent contractors, or partners. And this is how they can get away with sort of loopholes around this. And this can become a conflict of interest because it can influence referral behaviors. And we have to think about the best interest for our client and not any gain for ourselves. Another potential conflict of interest can be dual relationships. This happens when a mental health professional develops another important relationship or role within a patient's life. This can happen over time, meaning a relationship can come after the other or simultaneously. Dual relationships can definitely affect the process of therapy, and it can later on present ethical dilemmas as well. An example of this within Christian ministry can look like a church member who is seeking counsel from someone that they already have a personal friendship or pastoral relationship with. And this can lead to biased therapy, and it can also blur boundaries and make it difficult to maintain professionalism. Next, I will be focusing on how our own values can conflict with our decision making as professionals. And this can really impact our clients within this field as well. So this is something we must stray away from. This can include personal views such as faith. That we are human and we are going to have times where our views and our faith may clash with our clients, but it's very crucial to still stay professional and maintain neutral and give ethical, client-centered care. This must be a priority because we are focusing on the client's values and needs above our own. Although there are such as the Code of Medical Ethics and American Medical Association, they do acknowledge the respect of physician autonomy, but we must find solutions when working with clients that do have different values or views. This can include simple things such as being conscious of our wordings and how we approach situations so that the client can still feel validated and respected throughout their sessions with you. Another personal view that can conflict our decision making can be our own perspective of specific treatments, where a mental health professional may feel strongly about certain approaches, such as CBT therapy over medication, as well as faith-based counseling over secular therapy. This is something where we may feel as though we know best, but we must respect our clients, and they do have a right to choose their own treatment plan. So, thankfully, there are ways to go around this, and such as discussing different approaches, different options. Be be specific about how we recommend, where we're still empowering the clients and giving them informed choices. There are also 5 ethical principles within counseling, which I will be referencing from the AACA, or American Counseling Association. First will be autonomy. This is where we respect our clients' rights, as I mentioned earlier. Clients have the right to make their own decisions about their treatment, and this is something that we must take into consideration. As well as justice, being fair and giving equality to all clients receiving treatment. They must have this equality regardless their background. As well as beneficence, which is doing good to our clients. Counselors must actively promote the well-being of our clients, as well as non-maleficence, which is where we should not do any harm. We should be avoiding physical, emotional, and psychological harm to our clients during treatment. And lastly, fidelity. This is where trust and honesty comes into play. Counselors must remain loyal and trustworthy with our clients to create that safe space. Within these principles, of course, ethical dilemmas may arise, such as a client may refuse treatment. In this case, autonomy must be respected. We can acknowledge and respect the client's right to make their own treatment choice, even if it differs from our own. And a solution for this, again, is being generate potential courses of action, as the ACA mentions. Exploring alternatives. Work with the client. Make sure that they still feel empowered and comfortable with their choices as they also hear your recommendations. There may also be a case where the counselor must break confidentiality. Of course, trust is a priority within mental health and wellness as a professional, but there are times where this confidentiality must be broken. This is when it's important to familiarize ourselves with the local, state, and national laws that mandate reporting for certain situations such as child abuse, elder abuse, neglect, or suicide threats. We must be aware of the reporting procedures and protocols for when this must be done. These ethical standards are here not only as our professional duty, but also it is essential to be providing high quality care. I hope that coming into this field, that this presentation will guide you to create a safe space for your future clients. Thank you.